Treat your back and neck pain without surgery. A broad management protocol makes all the difference. I'll explain that. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I want to try to change lives today, which I know that sounds dramatic, but when someone is able to avoid spinal surgery or something huge like that because I gave them some evidence-based, research-based education that they didn't have, well, that's life-changing lots of times. In fact, be sure to share this information with anyone that has been told they're going to have surgery for their back or neck. You might be the one changing their lives. Did you know that neck pain affects approximately 30 to 50% of adults in the general population in any given year? Here's the scary information that goes with that though. Approximately 50 to 85% of individuals with neck pain do not experience complete resolution of symptoms, and some may go on to experience chronic, impairing pain. Now that's not a good statistic, right? Neck pain is undoubtedly an issue, but back pain is an even bigger problem. 80% of Americans will experience back pain at some point, and I want to go on record saying I'd like to meet the 20% that doesn't have back pain, right? Americans spend at least $50 billion annually treating low back pain. Worldwide, back pain is the single leading cause of disability. Back pain is one of the most common reasons for missed work. 1/2 of all working Americans, 1/2, admit to having back pain symptoms each year. Nearly 1/3 of women suffer from low back pain compared to 1/4 of men. Now that we've established the significant mountain of difficulties that neck and back pain can present to us, not only as healthcare providers, but also as members of the general population of pain patients, well, is there anything that can be done about it? Let's say this. Traditionally, the medical field has approached pain from a biomedical perspective, which means they looked for a simple biological cause, and then they injected it or medicated it or cut it out, hoping to solve the pain. Nowadays, pain science is much different and advanced and has moved further and further away from that model. So we certainly know now that throwing opioids at the issue, that didn't do anything but make life a lot worse for millions of people. Now we understand that pain is a lot bigger than that. Pain, especially chronic pain of any sort, it can't be cut out or injected and be expected to simply just disappear. Pain is made up of the biopsychosocial matrix, which means the biomodel has a part to play, as in the traditional approach we just talked about, but pain also has a cognitive aspect, because your pain experience comes from your brain. It doesn't come from your hip joint or your arm or whatever might be hurting. Your back, for example. Pain is also a result of social constructs, like what kind of support a patient has at home, what kind of funds do they have for treatment, things like that. So as you can see, pain can be difficult. The perfect example of this is that back pain has only become a bigger and bigger problem over the years. With medical advancements and technology, wouldn't we expect back pain to become a smaller and smaller issue over time rather than a bigger issue? Well, the American College of Physicians and American Family of Physicians, they've all agreed in the last 4 to 5 years and recommended that acute and chronic back pain's first recommended treatments should include the following: spinal manipulative therapy, exercise, we do that too, massage, you can find that here, acupuncture, we've got that, low-level laser, we've had that for several years. Heat. Most clinics should have heat. We do too. Tai Chi, yoga, and cognitive behavioral therapy, to mention a few. Now you'll notice that by saying this, I indicated which of these recommended first-line therapies are commonly offered within evidence-based, patient-centered offices like ours, like you'll find right here at Creekstone Integrated Medical. These are medical organizations making these recommendations, and this is the future. for non-complicated neuromusculoskeletal complaints for patients of all ages. In addition, if the patient prefers, low-grade medicine may be added to the broad management protocol, and we have medical services here at Creekstone as well. Now, once all of these have been tried and failed, a patient may proceed to stronger medication and more invasive means of treatment like joint and spinal injections, and potentially, as a last resort, surgery. Never the other way around, where surgery is at the top of the list and comes first, unless there's something complicated going on like progressive neurological deficit or Cauda-Equina syndrome, something real serious. So treat pain and do it effectively without surgery, without scare tactics or more serious interventions. Treat pain effectively through the broad management protocol and medical and chiropractic team approach that you're going to find right here at Creekstone Integrated Medical. If you're from the Amarillo area or you're going to be passing through, you want to be seen and evaluated, why don't you call us at 806-355-3000. Let's get you on our schedule. If you're watching on YouTube or Facebook, please subscribe, like, comment, and share. As I mentioned, you really might change some lives through the simple click of a button. Again, I'm Dr. Jeff Williams, and we'll see you back here next week.